Okay, in this video, we are going to cover the remaining mental health medications that are part of our pharmacology flashcards edition 2.0. We're going to talk about ADHD medications, medications for alcohol abuse and opioid dependence, as well as medications to help with smoking cessation. If you are following along with cards, we are on card 65 in the nervous system. First, let's talk about central nervous system stimulants, which are used to treat ADHD as well as conduct disorder. Medications that fall within this class include methylphenidate and amphetamine mixtures. These medications stimulate the central nervous system as well as the respiratory system to increase mental alertness and to increase attention span in patients who have ADHD. So when I look at these drug names, which are, again, methylphenidate and amphetamine mixture, it really just reminds me of methamphetamines, right, or meth, which will amp you up if you took those. So that's basically what these medications do. They really stimulate the central nervous system as well as the respiratory system to help people with their alertness and their ability to concentrate. So I find it fairly easy to remember what these medications do just based on the drug names. In terms of side effects can include insomnia, dysrhythmias, and then perhaps most importantly, decreased appetite and weight loss. These medications also carry a black box warning because drug abuse as well as dependence is common with these ADHD medications. In terms of teaching, we're not going to want to give this medication at night because of that side effect of insomnia. So giving it in the morning would definitely be better for the patient. We would give the medication about 30 to 45 minutes before meals, and we're definitely going to want to monitor the patient's weight during therapy because weight loss is a very common and important side effect to remember with ADHD medications. Okay, let's now talk about maintenance medications for alcohol abuse. Medications that fall within this class include disulfiram, naltrexone, and acamprosate. Keep in mind, these medications are not for an acute alcohol withdrawal situation. So if a patient is undergoing acute alcohol withdrawal, then our attention is really focused on trying to decrease their vital signs and prevent seizures. So we would give them medications such as benzodiazepines, beta blockers, and anti-epileptics. These medications that I'm going to go over are really for long-term abstinence from alcohol. So they work a little differently. So disulfiram works as a deterrent because if the patient ingests alcohol while they're taking disulfiram, they will get this very unpleasant reaction, which includes vomiting, palpitations, sweating, and hypotension. In terms of how naltrexone works, it works by helping to suppress the patient's craving for alcohol, and acamprosate helps to decrease abstinence symptoms, which can include anxiety and restlessness. So one way that I remember acamprosate is I think of someone being sent to a camp to try to stay off of alcohol, and at that camp, they were given acamprosate. So that's just my little tip for remembering what this medication is for. Okay, now let's talk about maintenance medications that are used for opioid dependence. So this includes medications such as buprenorphine and methadone. These medications are not only used for opioid withdrawal and maintenance, they can also be used in the management of patients who have like chronic severe pain. They work by binding to opioid receptors in the CNS, which helps to decrease pain, but also results in central nervous system depression. Because it is binding to opioid receptors, we're going to get the same type of side effects that we would see with opioid analgesics. So this includes sedation, confusion, constipation, hypotension, and respiratory depression. There is a black box warning for this medication because it can cause respiratory depression. It can also result in prolonged QT intervals. So it does cardiac depression as well. Keep in mind that the antidote for these medications is naloxone, okay, or Narcan is the brand name. So it's important that if a patient is going to be on one of these medications that you really keep an eye on their vital signs, their pain level, as well as their respiratory status. And then you want to advise your patient to increase their fiber and fluid intake to help prevent constipation, which is very common with this medication. All right, now let's talk about a nicotine agonist, which is varenicline or Chantix. This medication is used to promote smoking cessation. It works by binding to nicotine receptors, which in turn decreases an individual's desire to smoke. So the little cool chicken hint that's on this card here is varenicline makes your veins clean of nicotine. So hopefully that will help you remember what this medication is for as well. In terms of side effects, varenicline can cause anxiety, depression, irritability, GI upset, insomnia, and muscle pain. This medication did carry a black box warning for many years due to neuropsychiatric events. So if your patient is on this medication, you'll just want to monitor them for depression or suicidal thoughts. Also keep in mind there's one other medication that we talked about when we covered medications for depression that also helps with smoking cessation, and that is bupropion. And you can find that on card number 58. Also keep in mind that there are nicotine replacements that are available over the counter, including gums, patches, and nasal spray. Okay, that is it for the mental health medications in our nervous system section. Next up, we will be talking about analgesics. Thanks so much for watching.